Hey guys, welcome back to my YouTube channel. So last time I made a video I was about 3 to 4 weeks. That's around the time that I found out I was pregnant, even though I knew I conceived just slightly before then. My son's sleeping right there, so I have to be a little quiet. So this video I will be updating you about week 5 and 6. Join me in my next video for week 7 and 8. So I want to just mention that a lot of women don't think about it unless they've already experienced it, is an ectopic pregnancy right before they get pregnant or during the time that they're trying to conceive. You actually really start worrying about it when, you find out that you're pregnant. Because all those cramps that you feel, bloating, pains, especially in one spot, and then there's a lot of cyber contracts like me, and Dr. Google is just going to tell you that you're having an ectopic pregnancy, and it's very worrisome, and it's a lot of stress that a lot of girls don't need. So that was a big one for me, and I worried and worried and worried until I had, the pains just started going away. So for week 5, I'll be reading a little bit. So I worried about ectopic pregnancy. I had really bad cramps. I had period-like pains, so the back of my lower back where my dimples are, all the way down to my butt cheeks and all the way down to the top of my thighs, it hurt really bad, like period pains, and I couldn't wrap my head around it because it wasn't the same with my first pregnancy. I did not feel that at all. I had really bad acne, and I had acne all over places that I've never had acne before. With my first pregnancy, I had acne in the beginning as well, and it wasn't even that bad, but they did prescribe me some medication because my skin became like a little allergic to some acne treatments, spot treatments that I was using before. There was a chemical in it, so they prescribed me something. My face actually went really numb and red with the spot treatments that I would usually use. This time around, the acne, I feel like, did not stay. So I also had muscle and joint pain. That was in the back of my neck, my knees, my arms. My nausea was on and off. So in that beginning of the week, I didn't know if I was going to be a puker or not. So with my first pregnancy, I never did. I just had really bad food aversions. My sister, Savannah, actually, she had really bad nausea. Like, she would puke just at the sight, smell, the thought of everything. Like, she's lost probably about 20 pounds when she first got pregnant. Maybe even a little bit more. I don't know. So she puked a lot. And me, on the other hand, I did not start puking during this week. So my nausea was on and off. My fatigue and insomnia was on and off. So there's some nights I just could not go to bed because I was just uncomfortable in my own body. And then my fatigue, I was really getting lethargic. I just couldn't really move. I didn't want to do much. I didn't want to run around. Like, I just felt tired. But I wasn't taking naps during the time, maybe once during that week. That was the start of my dizzy spells. That's what had me so worried about as well with the ectopic pregnancy, is because I was just dizzy. Like, the feeling that you would get in being in like a sauna or like a really steamy bathroom for a while, and you just get out and you're just really dizzy. But me, it lasted for about an hour. It happened every day. Sometimes it was on and off throughout the day. It was really bad. Sometimes I would actually have to go to sleep just because it was that bad. Like, I just had to rest my head down. So that was the start. I did mention in my last video I had CM. So pregnancy, in the beginning of your pregnancy, there's a lot of CM, and it's only building up. I had sharp pains in my pubic bone, sharp pain in my cervix, so like I'm assuming that those are probably round ligament pains. I called Swansea Midwifery. That's where I wanted to go. It was a really beautiful birthing center, and it kind of looked like an extravagant hotel. So it was all glass, you could see outside, and also some walls. It was a really big room, like I don't even know, it was massive, just so much room. It could probably fit like a couple hundred people in there. Not really, but you know what I mean. So there was what was it, a birthing tub. It was, the way that they designed it was really homey, but it was also like very fancy, you know, just having really nice stuff in there. So like the birthing pool was like stone on the outside and the inside. It was just really pretty. I would have loved to have been there. And the bed, they had a king size bed, and then, you know, they had just a massive room for a whole bunch of people to come in, which I've mentioned before. And I would have loved to go there. The problem with that for me is initially I thought they did C-sections there because they said that they do VBACs and they will handle a C-section properly if it needed to happen. So with my first son, I delivered him by C-section after 3 days of natural labor. And I really wanted to go for a VBAC again naturally, and that would have been my dream place to go to if I had found out to begin with that I was pregnant. Maybe my pregnancy or my labor and delivery would have ended up differently with my son, but either way, I'm happy that he's here and safe, and so am I. So the thought of them not doing C-sections there really just, you know, made me really nervous. It made me hesitant, and I really changed my mind real quick, because they would actually drive you. They wouldn't call an ambulance. I guess that would just get there quicker, but they would drive you to the hospital, which is about 15 minutes away, and do the C-section. If I was to have like a uterine rupture, or my son or daughter just wasn't coming, you know. So I didn't really want to take those chances, so I just chose that I would call the hospital and schedule my first appointment in Keene, so that way if I did need to have a C-section, I was already there. I didn't have to wait any longer, you know, than I needed to be seen by somebody and have surgery. And I can always have a doula and a midwife there as well. I just would be missing out on having that home birth feeling that, you know, you could absolutely want. So I called Keene, and they scheduled me for an appointment about 5 weeks, 4 to 5 weeks, I think, after I found out I was pregnant and I had seen, you know, the Swansea place. So they scheduled me in for March 12th. And so let me just go ahead. So I did that. So that's what I wanted to say, is that they wouldn't be able to take me in for that long, and that was just to confirm my pregnancy, to do a urine test, and to talk with a nurse about what to expect during those 3 trimesters. And that just felt so long. Like, just, I would have already been getting close to working in my 2nd trimester. And by time they said that it would take about 5 to 8 weeks before I actually had my first prenatal visit and ultrasound to confirm how long I am and whatnot. So I would have actually been into my 2nd trimester, like probably a few weeks into my 2nd trimester by the time I would have actually, you know, and to me that's unacceptable. The way that they handle stuff like that, I don't care how busy you are, you know, just decline somebody instead of making somebody wait that long. Because if it wasn't me and it was somebody else, they probably wanted to handle their pregnancy a whole lot differently than what I did, you know. And I was very impatient, you know. You can't just sit there and just wonder and, you know, go through all these pains and just want to take care of yourself, but you're being like refused immediate care. Anyways, so I called Brattleboro, and they said I can go take a urine test anytime I want. So I could just go in any day I want. But I decided to wait. I didn't go in for a little bit. I decided to wait and just see how Keene was going to go, to see if I could be patient and if my crampings and everything were going to go away. So after that whole ordeal, during that 5th week as well, I didn't work out. I stopped working out. I couldn't get it in me to do anything at all, just from being lethargic. I called my old OB as well, I forgot to mention this, and I found out she was retired, and she's the one who actually referred me to go to Keene. So I called my old OB, the one who delivered my son, after I seen Swansea. And so for my week 6, my fatigue was getting way worse. My nausea started getting really bad. Like I was hardly eating at all. I felt really bad for my baby inside me, but I kept thinking to myself, okay, so it's still surviving off the yolk during this time, and nausea is just really common. A lot of people lose weight during this time, so I just wasn't going to worry about it. Just eat little bits that I can here and there. I ate little to nothing, and I decided, because I was concerned, to go see my primary care doctor. And she just basically confirmed that I was pregnant with the urine test, asked if I wanted to do a blood test. I refused that because I was possibly going to do it 2 more times, you know, following that. So I refused the blood test, and she just checked my weight. I weighed 168 pounds then. Or, sorry, 167 pounds at that moment. I had a lot of odd body pains in my arms, etc., my neck, just a lot of aches. My pubic bone hurt. My belly was very tender. So right under your belly button, that whole area was just tender. And that lasted for those few weeks. It was just every time that my son would jump on me and push on my stomach or come up to me and run and hit me, like, it would take my breath away. It was very tender. It hurt. And my left kidney area hurt. My boobs and nipples were getting very sore. Like, I really just wanted to start ending breastfeeding because it just hurt all the time. It was just uncomfortable to breastfeed. And I was feeling really miserable and tired. Like, I was starting to get depressed just because I felt like I wasn't being a really good mom to my son, just because I needed to just rest. And I really wasn't getting help, and my husband and nobody at this other time knew that I was pregnant. My husband did. And he just is not really considerate and thoughtful of a pregnant woman, so he kind of just did his own thing, hung out with his own friends, and, you know, just sat down on the couch and played video games and whatnot. He didn't really care that I needed a little bit of rest or some time to just go to sleep. Like, to me, that was a very important time, you know, just to get a lot of rest and stuff. I have a growing baby in me, you know, so there's a lot of resentment going on. I dealt with it in my first pregnancy, you know, and that's a whole nother story. So I was also having forgetfulness. I just wasn't remembering much. Like, it came down to, like, if I had a cup of coffee, or where did I stick the car keys, or did I need to do some laundry, or, like, just a whole bunch of little stuff I just forget. And my heart started throbbing then too. So that to me felt like more like pounding, not racing, but like pounding, like where I get normal heart palpitations, and I could feel it in my chest. So to me, my heart would start pounding, like, and you could feel it. You could almost like hear it coming out of your throat. It's like loud. So, and I just thought that was normal, even though I didn't have that with my first pregnancy. I just thought that was normal because as a hypochondriac, you know, you go on Dr. Google and you do a little research, and that's what I did. And it says that your heartbeat actually pounds about 40 to 50 times more beats per minute than it would pre-pregnancy. So that's what I dealt with. I also had tons of bloating, and round ligament pain was probably some of the worst stuff that you could feel going on down there. I'm not sure if that's what caused my tender stomach. So I, for nausea, would try handling it by drinking some ginger ale. And it wasn't my normal Canada Dry stuff. I actually went out and spent $2.50 per small glass bottle with like little ginger bits inside of it, and ginger ale did not help me at all. Like, it was refreshing during that time, but it did not do its duty. So I was actually craving sour stuff at the time, and then I decided to try lemonade because that's the first thing I saw, and I started craving it really bad, and that helps with nausea. I'm not sure if it's because it has a little bit of sugar in it, and it can help your sugar levels just rise a little bit, and that will help nausea. But the lemon as well, that was really nice. Lots of lemonade, yeah. So yeah, I had no puking during that time either. I noticed during that time as well that my gums would start bleeding a lot, and they felt swollen, and I'm not sure if that's what the cause of all my teeth pain were, my teeth sensitivity in the beginning when I was trying to after I conceived. And I noticed that, which I've had with my first child, is that every time I blow my nose I would get tons of blood in it. So that has gone on every single day throughout my pregnancy. I do want to mention that like I've said before, I'm going for a VBAC, and that's going to be natural as well, and I really hope to God that this time it goes right. I am hoping for a girl, even though I will be absolutely okay if I had a boy, just because I have tons of boy stuff already, clothes, toys, and it would give my son another little boy to hang out with, and I would like that. But I also really want a girl, and I have a name picked out already. I'm thinking about Anastasia. Thinking about using my grandmother and my sister's middle name, which is Nadia, so Anastasia Nadia Minor, that's what it would be, or my grandmother's first name, which is Ida, so Anastasia Ida Minor, which doesn't sound necessarily right just because I think Ida's a first name, but I've always wanted to use her name. So yes, that's it for week 5 and 6. Please join me in my next video for week 7 and 8. Thank you. Please hit the subscribe button, the like button. I really think that this is fun, and to document my pregnancy. I really wanted to do it with my first, but I just don't know where that went wrong. So thank you.